What is your assessment of how long it will take to produce a vaccine? And of course, then the issue of mass producing it in sufficient numbers for the entire planet.
Yeah, those are great questions. So, among public health people, I tend to be on the optimistic side. So you should know that, because what I'm going to tell you, obviously, my views is a bit more optimistic than I think where most public health people are. But that said, let me give you my views on this. I am pretty optimistic we're going to have a vaccine. I am very optimistic that that vaccine will come in 2021. It's very, very hard for me to see a vaccine being safe, effective, and widely available in 2020. I can't quite figure out how that would happen. Obviously, again, love to be wrong, but I think sometime in 2021, and I'm guessing probably mid-2021 as my best guess. Now, let's talk about where we are on vaccines. So over 100 different efforts to build a vaccine. There are 8 that are in clinical trials, and a few of them are moving along very nicely. There's Moderna, there's the Oxford one, there's one, actually 2 in China that are both also potentially promising. There are others in Europe. So there's a lot of activity here. I have no idea which of these vaccines will play out and when, right? I have no idea which one will turn out to be safe or effective. Any of them could. It could be that we have 5 or 6 vaccines that work. I don't know, but I am very confident that one of them will. And one of the reasons I'm so confident is that we have been able to show that we really can induce immunity to this virus. We know that people clear the virus. They get a pretty robust immune response. And so scientifically, believing that we're going to have a vaccine in 2021, I think is a pretty fair assumption. Now, the other question of, okay, you have a vaccine. Let's say, you do the testing, it's safe, it's effective. How do we make sure everybody gets it? And that is going to be a massive challenge. And there's a huge set of production issues. There's a huge set of distribution issues, equity issues. I think it's incredibly important that, people in India get it, people in Kenya get it, people in the United States get it, people in China get it. And that is going to require a certain amount of global coordination. It's going to require a certain amount of global solidarity. And I worry a little bit about kind of where we are heading, certainly our political leadership, but other political leaders too, in terms of that movement towards global solidarity.